So I met Dr. Samantha Ahdoot through her work for a conservation easement on her farm in Sperryville, Virginia last year. And I learned that she is an incredible person because, she has a real passion for the wildlife and natural environment and water quality on her property. We've done a Headwater Stream Initiative project. She's worked with CRISM to remove enormous amounts of invasive species and done an EQIP program to restore quail habitat and bird habitat on her property too. But beyond that, Dr. Samantha Ahdoot is a practicing pediatrician at Pediatric Associates of Alexandria in Virginia and an assistant professor of pediatrics at Virginia Commonwealth University School of Medicine at the Inova campus. She served on the American Academy of Pediatrics Council on Environmental Health Executive Committee and was the lead author of their Global Climate Change in Children's Health Policy Statement and Technical Report, which was published in Pediatrics in November 2015. Dr. Ahdoot wrote the climate change chapter in the AAP's book, Pediatric Environmental Health, the 4th edition, which is published just last year. And she speaks widely across the country on this topic. She serves on the board of the Virginia chapter of the AAP and is the chair and co-founder of the Virginia Clinicians for Climate Action, a coalition of clinicians bringing climate and health education and advocacy opportunities to the medical community here in Virginia. So thank you, Dr. Ahdoot, for bringing your expertise to us today.
Well, thank you so much. I'm really excited to talk to you all today. I'm going to share my screen now and go to my presentation. All right, I have it here. Great. Well, again, thank you so much for the invitation to speak to Piedmont Environmental Council today about health in Virginia's changing climate. And I have no relevant financial relationships to disclose. So I'd like to begin today's talk with a brief introduction about how I, as a pediatrician, came to care about climate change. I finished my residency in pediatrics in 2002. I had heard a little bit about climate change, but I really had not given it a lot of thought during the busy years of medical school and residency training at Tufts in Boston. And that changed in August 2002 when my son Isaac Marcus was 2 months old. My husband Ken had one more year of his residency in OBGYN, and Isaac and I were living in the town of Somerville, just outside of Boston. We had a small apartment with a one-window air conditioning unit, but no central air. And when Isaac was 2 months old, Boston had a record heat wave. We had 8 days in a row above 90 degrees. And that was only the 4th time that Boston had ever experienced such prolonged, intense heat. And I was home alone with Isaac while Ken was still in residency, and I got sick of sitting in the bedroom with the air conditioner, but I was also scared that my young infant would get overheated in the hot apartment. So I spent 8 days sitting in a local Starbucks with Isaac, trying to keep him cool. And during those long days, I had a lot of time to reflect on my own childhood summers visiting my mother's family in coastal Massachusetts, the town of Kingston. And I had no recollection of ever feeling that hot during those many summers that I spent there. I started reading more about how the summers were getting hotter, not just in Massachusetts, but across the world, and that this was part of a larger phenomenon called climate change. I joined the American Academy of Pediatrics Council on Environmental Health, and I embarked on the years of learning that have led me to speaking with you all today. So to kick off our discussion, I'm going to start with a very brief Climate Change 101. I know that this is very familiar to a lot of you, so please forgive me, but I think it's important to lay a foundation. So the greenhouse effect is what underlies the whole climate change phenomenon. It was described back in the 1800s. It can be demonstrated in middle school science experiments, and it's not in any dispute. Here's a brief graphic video from NASA about the greenhouse effect. So sunlight reaches the Earth, and some of this energy is reflected back into space, but some of it is absorbed and re-radiated as heat. And this re-radiated heat is absorbed by greenhouse gases and reflected in all directions. And these are what warm the Earth. These gases include water vapor, carbon dioxide, methane, nitrous oxide, and others. And they don't generate any heat. They just retain the heat that is reflected off the planet. And these gases are essential for life on Earth. Without them, all of the sun's energy would be lost back into space, and the planet would be very cold and inhospitable to life. But since the Industrial Revolution, people have been burning fuels made from fossils buried deep in the earth, such as coal, oil, and gas. And when we burn these fuels, called fossil fuels, we release greenhouse gases, which had previously been stored deep in the planet. Combustion of these fuels, as well as cutting down of the Earth's forests, has led to a dramatic increase in the concentration of greenhouse gases in our atmosphere, particularly carbon dioxide. These heat-trapping gases are, not surprisingly, trapping more heat and causing the planet to warm. So carbon dioxide levels have waxed and waned over millions of years, but over the past hundreds of thousands of years at least, had not gone above 300 parts per million. CO2 level has been skyrocketing, as you can see, over the past century, where as last time I checked, we were at 414 parts per million, but this is rapidly increasing and is constantly updated on NASA's website. Modern human civilization, remember, is only about 10,000 years old. So we have never encountered CO2 concentrations at this level. So it's truly an unprecedented experiment for human society and truly for all living things currently living on the planet. The last time the atmospheric CO2 concentrations were this high was more than 3 million years ago, when the temperature was about 2 to 3 degrees Celsius higher than the pre-industrial era, and sea level was about 15 to 25 meters higher than today. So where does all this CO2 come from? Well, U.S. emissions can generally be broken into 5 areas. The biggest contributor now is the transportation sector. Electricity production generates the second largest share of U.S. emissions. Next comes industry, which includes burning of fossil fuels to produce goods from raw materials. Our businesses and homes burn fossil fuels for heat and cooling. And lastly, the agricultural sector, primarily from livestock, also from agricultural soils and food production. So as I said, more heat-trapping gases are not surprisingly trapping more heat, and the Earth is getting hotter. And this is the expected result. It would be unexpected if the Earth weren't warming. This is a graph of global land-ocean temperature relative to the 1950-1980 average. The average anomaly is about 1.8 degrees Fahrenheit or 1 degree Celsius warmer. 19 of the 20 warmest years on record have occurred since 2001, with the exception being 1998. 2016 is currently the warmest year yet recorded, and both 1998 and 2016 were El Nino years. So here's a brief graphic from NASA, which illustrates how the planet has warmed since 1880. And this was produced in 2018, so it's a little older. You can see from the thermometer on the upper left-hand corner that blue indicates cooler and red indicates warmer. And it shows the increased temperature of the planet since 1880. And please note the dramatic increase in the poles. Oops, didn't mean to play that again. 1 second. Here we go. All right. So But warming is not occurring equally or everywhere. This image is from the Washington Post, an article published a few months ago. And the Post found that more than 1 in 10 Americans, 34 million people, are living in counties that have already warmed by more than 2 degrees Celsius. These people are already experiencing reduced water supply, increased wildfire risk, and reduced winter snow and ice. But you can see that there are some parts of the country that haven't warmed at all. And what does the future have in store? Well, that depends on how much more heat trapping gas we emit. More emissions will mean more warming, and less emissions will mean less warming. Under a business as usual scenario, which is the red line at the top, if we were to continue at our current rate of emissions, by 2080 to 2099, when my son's in his 80s and 90s, the global average temperature is projected to increase by 4 to 8 degrees Fahrenheit relative to the 1980 to 1986 to 2015 average. And that's the red shaded area on the right. But if emissions have already peaked and we start reducing emissions now, we could limit warming to 0.4 to 2.5 degrees Fahrenheit. That's the green shaded area on the right. And of note, the goal of the Paris Agreement is to limit the rise in temperature by another 2.2 degrees Fahrenheit relative to the 86-2015 average. Now, warming temperatures are causing melting of ice sheets and glaciers, and this, in addition to thermal expansion of warmer water, is causing sea level to rise. And like warming temperatures, this is not affecting all areas of the country or the world equally. Sea level is rising much faster on the U.S. East Coast than the West Coast, and Virginia's coastal communities are experiencing the highest level of sea level rise along the Atlantic seaboard. And this is a combination, due to a combination of their sinking lands, in that region and the coast, as well as changing currents and warming ocean water. This has led to increased nuisance flooding in Norfolk. This graphic shows the significant increase in hours per year that the water level in Norfolk is at least a foot above the mean high water mark. And that's what corresponds to minor street flooding. Like temperatures, according to the National Climate Assessment, how much global average sea level will rise also depends on how much more heat trapping gases humans produce and the response of the climate system to warming. So what's happening in Virginia? It's hotter. 2010 to 2017 was the warmest decade on record in the southeastern United States. Many cities and towns in Virginia are experiencing more extremely hot days. Charlottesville, for example, has more than 6 more days above 95 degrees than we did in the 1970s. Summer heat is extended later in the year. Our winters are milder. And that means we have a longer season without frost and a longer growing season. Warmer air holds more water. This is leading to more heavy rainfall events. And plant and wildlife patterns are shifting in response to the changing climate. All right, so I'm a pediatrician. Why am I talking to you today? I'm going to be talking to you about health. And so what does all this have to do with people's health? So physicians are seeing the health effects of climate change on our patients today, and these effects are expected to become more apparent as the planet continues to warm. Changes in the climate are influencing where, when, and how often certain infectious diseases occur. Warming temperatures, as well as increasing carbon dioxide, are affecting the growth and the composition of some plants, including some of the world's most important food crops and the plants that cause allergies. Rising temperatures, hotter summers are putting more people at risk of heat illness. And worsening extreme weather events can harm people directly through injury or even death, and can have lifelong indirect effects. So in the rest of today's talk, I'm going to be talking about 3 specific climate-related health impacts. And I'm going to say I could speak about 3 totally different ones, but I would prefer to speak a little bit more in depth about 3 than just touch on a few. I'll be talking about heat-related illness, infectious diseases, and changing plants. So I'm going to start each topic with a patient from my practice. This is Matthew. Matthew is a 15-year-old patient of mine, and on August 2nd, it was his first day of football practice. His coach scheduled 2 practices that day. During second practice, he developed pain in his legs. He was treated with massage and sent back to play, but the pain spread and went to his back, and he collapsed. He was sent to the emergency room where he was found to have muscle breakdown or rhabdomyolysis, which led to kidney injury. We treated him in the hospital with IV fluids for 3 days. He recovered completely. And 3 of his teammates were treated in the emergency room for heat illness on the day he was admitted. So heat-related illness occurs when our body's thermoregulatory response to heat gain is not sufficient, resulting in an elevated core body temperature. And heat illness includes a wide range of illnesses, which can be quite mild, including cramps or syncope, passing out, or heat stress, to moderate heat exhaustion, to severe and potentially fatal heat stroke, which is characterized by major organ damage and central nervous system dysfunction, as well as a significantly elevated core body temperature. So as we stated before, Virginia's getting hotter, both our average temperature and episodes of excessive heat. This past July was the hottest July ever recorded in 7 states, including Virginia, and more extreme heat is putting more Virginians at risk of heat illness. So who gets sick in Virginia's extreme heat events? Well, I'm going to be talking to you now and describing how it's mostly young men, and rural areas bear a significant burden of heat-related illness. So this past July, as I said, we had a record high temperatures for the month of July. And between July 17th to 21st, Virginia experienced a heat event that resulted in 275 emergency room or urgent care visits. Now, as you can see in this graph, men are the light blue color on the top, and they're significantly more represented than women during these heat event. Now, who were these men? They were mostly younger men in their between 20 to 50. Although the age obviously extended later as well, but the predominant numbers were younger men. Now, increased emergency room visits for heat during this event were spread across the state. You can see from this graph that 29 of 35 health districts had increased heat visits during this 5-day period of excessive heat. It was not just in Virginia's urban centers. So this vulnerability of men in rural areas has been documented in numerous studies regarding the southeastern United States. This slide is from a presentation by Dr. Chip Conrad to Virginia Department of Health. He's a professor at UNC Chapel Hill, and it depicts the patterns of emergency department visits for heat-related illness in North Carolina. You can see that the highest risk groups, represented in orange and red, are in rural parts of the state, not the metropolitan centers. And this increased rural vulnerability to heat illness was attributed to greater numbers of outdoor workers, especially those working in agriculture, more low-quality housing with poor insulation, more energy poverty and reduced access to air conditioning, and also reduced access to health care. This slide depicts the demographics of those emergency department visits in North Carolina for heat illness. And they found that men had 3 times the rate of visits than women, and men in rural and isolated areas had the highest rates. Women in metropolitan regions of North Carolina had the lowest rates of emergency visits for heat illness. Similarly, a study that was published by a team from UVA this year found that emergency room visits increased by 6 to 7% in Roanoke during heat waves, and this effect of heat was greater in males. Now, the numbers are different when you look at heat-related mortality. The groups at highest risk of heat-related mortality are consistently found to be our age extremes, the elderly and infants. This is a study of heat-related illness and death in Florida from May to October of 2005 to 2012. And this study, like the research in North Carolina, found that highest rates of emergency room visits for heat, the dark blue bars that you see here, are in younger people. Now, this study was non-work related heat illness. So in fact, we see more of our high school age men, which are presumably athletes, at least in large part. Now, the black line is heat-related deaths. You can see that these rates were highest in infants and in the elderly. And this is consistent with a much larger body of research showing the higher risk of heat-related mortality in these age groups. Of note, 22 of the 139 deaths were children left in a vehicle, which helped explain some of this increased risk in young children and infants. So pregnant women, the developing fetus, and young infants are increasingly being recognized as high-risk groups to extreme heat. Exposure to extreme heat has been associated with adverse birth outcomes, including preterm birth and low birth weight. Okay, I'm going to switch now to another topic, and I'm going to start with talking about my patient, Noah. Noah is an 18-month-old boy who came to my office after he returned from Maine, where he was on vacation with his family. And he presented with this rash. I diagnosed him with, you probably all recognize it, erythema migrans from Lyme disease. I treated him with an antibiotic, and he recovered completely. So as you all are very aware, tick-borne infections in the United States are increasing dramatically, and this is not just true for humans, but for dogs as well. And the reasons for this are complex, and they include changes in land use, wild animal populations. Remember, the white-tailed deer was almost extinct 100 years ago. But we know that warming, shorter winters, are allowing more days for ticks to be active and successful at reproducing, particularly in northern regions of the United States, North America, which were previously too cold for those ticks to survive. And this has led to increasing tick population density and infections throughout North America, particularly in New England and Canada. So in 1996, the black-legged tick was reported in only 12 of Virginia's 95 counties. This had increased to 72 counties by 2015. And these ticks are bringing Lyme disease with them. In 2006, there were about 357 reported cases. In 2017, this was increased almost fivefold to 1,650 cases. And these are based on, most Lyme disease is diagnosed clinically, so these numbers are thought to be a gross underestimation. And warming temperatures, longer warm season, earlier spring and later winter is contributing to this rise, as well as the increased population of deer and suburbanization. Now, New England and Canada have experienced tremendous increase in tick-borne infections, and these are expected to continue to rise as the planet continues to warm. My patient Noah would have been very unlikely to have gotten Lyme in Maine if he had gone there in 2001. But today, going to Maine carries a significant risk of contracting Lyme. Now, I think it's important to note that ticks actually don't like it very hot or dry. So as Lyme spreads northward, it is conceivable that it would retract in the south as it gets too hot for the ticks to survive in that area. This hasn't yet been true, as Lyme has also spread southward. In Canada, there's been a dramatic increase in Lyme cases. In 2009, there were a total of 79 reported cases acquired in Canada, and that increased to 667 in 2015. In Ontario, there was a threefold increase in Lyme cases in 2017 relative to the 2012 to 2016 average. Now, climate change is also contributing to a northward expansion of organisms in our water bodies, including harmful algal blooms. Species of algae are appearing in new locations and with increasing frequency. And this is a result of climate change and warming temperatures, as well as ocean acidification, better monitoring, reporting, and increased nutrient loading. This increase in harmful algal blooms is a major problem for our fresh water bodies, including our streams, ponds, and lakes. You may have heard about the large bloom that occurred in Lake Anna this past summer. Reports of these blooms in the United States has risen significantly since 2010 as a result of the numerous factors that I've mentioned. Now, these algae produce toxins that can poison humans, wildlife, and pets. They cause illness in humans and animals through ingestion, through inhalation, or through skin contact. And the symptoms can be in the skin, rashes, itching, and stinging. We respiratory symptoms, including cough, shortness of breath, wheezing, GI symptoms, and also neurologic, which in some of the more rare harmful algal bloom conditions can cause paralysis. But thankfully, these are very rare. I want to touch a little bit on the COVID-19 pandemic because it also highlights the interconnected relationships between humans, our environment, and infectious diseases. So this virus, like the 2002-2003 SARS virus, which is also a coronavirus, as well as the 2014-2016 Ebola virus epidemic, they originated in bats. Humans came in close proximity to these bats through altered land use, combined with rising human population density, and the infection spread rapidly across the world as a result of globalization. We also know well that temperature and humidity play a critical role in the transmission of many infections, including the flu, dengue, and chikungunya. And we suspect that it will influence COVID-19 as well. So the authors of this article recommend that to effectively address pandemics like COVID and to prevent future ones, we really need a planetary health lens to consider all these multiple factors, and we need to work together globally through organizations like the World Health Organization if we're to successfully combat this rising risk. One thing that I think is interesting is we're learning that higher air pollution from combustion of fossil fuels can increase the risk of illness and death from COVID. We know that higher particulate matter pollution increases the risk of other lung infections, like the flu or the SARS virus of 2003, which again, as I said, was also a coronavirus. And numerous studies from this year from the United States, Italy, and China have found that exposure to higher amounts of particulate matter pollution also increase the risk of coronavirus infection or death. So the last health topic I wanted to talk with you today is the health effects of changes in plants due to climate change. I'm going to start with my little patient, Sophie, a 2-year-old girl I saw in early spring. She was being treated with an oral antihistamine, but she continued to have these very dark swollen circles under her eyes. Her mother brought her to see me wearing sunglasses because mother was concerned that it looked like Sophie was being abused. She responded well to a nasal steroid. So rising temperature and carbon dioxide concentration affect plant growth, plant composition, and ultimately these changes affect people's health. So carbon dioxide is the primary substrate of photosynthesis. A study from 2018 found that almost 90% of plants, that photosynthesis of almost 90% of plants doubles when CO2 concentration approximately doubles. So more plant food, bigger plants, one would think would be a good thing. Bigger wheat plants, for example, would be better crops. Bigger trees would be better trees, right? Well, it's more complicated than that. C6H12O6 is human food. It's glucose. And human glucose levels, we need glucose in the body. Too little glucose and we get sick and can even die. So if a glucose of 20 is bad and a glucose of 100 is good, then is a glucose of 200 better and a glucose of 1,000 awesome? Well, no, of course. A glucose of 1,000 goes by a different name, and that's diabetes. Our bodies are designed to function optimally within a very narrow glucose range. While too little is dangerous and can kill us, so can too much. And as any diabetic will tell you, high glucose causes a wide range of far-reaching health effects on our risk of infections, fertility, and even on the birth outcomes. All biological systems operate within very narrow windows of optimal conditions. Whether it's the optimal level of sodium in our blood, we can die if our sodium is 120 or 170, or the optimal temperature for an alligator egg to hatch or to grow wheat in Nebraska. Humans and all living things have developed within certain conditions that have remained stable for tens of thousands of years, and changes in these conditions can lead to far-reaching unexpected consequences. Just like you would never think that a woman's having a sugar of 300 during her pregnancy would cause her baby to have congenital heart disease, so the changes in atmospheric CO2 can have unexpected consequences. So studies over the past 20 years have shown that numerous plant species, including those most likely to cause allergies, produce more pollen when they're grown in higher CO2. Some of the earliest research was done on ragweed, and a study done in 2000 by Ziska and his colleagues found that plants grown in a CO2 of that time, which was 370 parts per million in 2000, those plants produced about twice as much pollen as the plants grown in the CO2 concentration of pre-industrial times, 280 parts per million. Grass pollen has also been shown to increase in response to elevated CO2. This slide is from a study evaluating timothy grass, a major cause of summer allergies, and they found that grass grown at 800 parts per million produced 3 times more pollen than the plants grown at 400. A recent study looked at oak trees grown in different CO2 environments. That picture you see on the upper left-hand corner is an outdoor carbon enrichment facility in which trees were grown at 400, 560, and 720 parts per million. And the oak trees grown at 720 parts per million produced 1,300% more pollen than the plants grown at 400 parts per million. Now, in addition to rising CO2, rising temperatures affect the length of the growing season, and thus the amount of pollen produced over the course of the year. This image is from a retrospective analysis of temperature-related changes in allergenic pollen abundance and seasonality across the northern hemisphere. And Dr. Ziska used global data sets with 20 years more of consistently reported airborne pollen data. And he identified 17 locations across 3 continents within approximately 26 years on average of data. So there's a lot of information covering a wide range. And 70% of the locations showed significant increase in seasonal or annual pollen load. The days without frost, the warm days, or the longer growing season was significantly correlated with an increase in both pollen load and pollen season duration. So similar results have been found locally. Allergy Partners Richmond, they have a pollen lady who has been measuring pollen on their roof since the 1980s. And Science Museum of Virginia analyzed her data and found that the peak tree pollen count has increased 35% since the 1980s. They also evaluated when pollen season is starting in Richmond based on Allergy Partners Richmond data, and found that the peak tree pollen count was arriving a week earlier than in the 80s. And this is unpublished data. So the last concept I want to talk about is how rising CO2 affects the plants we eat. And this is not as immediately clinically relevant, but it has huge public health implications, and it's also just very interesting. So what is the ionome? This is not something I learned about in medical school. It's the elemental chemical composition of a plant, and it's the balance between the carbon, which is obtained from the atmosphere, and the rest of the nutrients obtained from the soil. And as CO2 in the atmosphere increases, it results in an ionomic imbalance in plants, where the carbon increases disproportionately to the soil-based nutrients. One of the most important soil-based nutrients is nitrogen, which is a building block of protein. And multiple studies from across the world over the past decade have shown that increasing CO2 in the atmosphere decreases the nitrogen and thus the protein concentration in many plants, including wheat and rice, some of the world's most important crops. Of note, corn is not affected in this way, and corn does not grow more in response to increased CO2. This image depicts the results from 2 studies which found that raising the CO2 from 290 to 715 parts per million progressively reduces the protein content of wheat flour. Now, many Americans might think it doesn't matter too much to us what the protein content of wheat flour is, because we don't get our protein from wheat. However, you need a certain amount of protein in wheat flour to make good bread or pasta. It is the protein content which determines the dough elasticity. You need about 11.5% protein to make adequate bread. Elevated CO2 also decreases the concentration of iron and zinc, as well as other essential minerals in wheat, rice, and soybean. This is a 2014 study from Nature. There's been numerous publications since 2014. This looked at 140 comparisons of crops grown at different free air carbon enrichment facilities, like I showed you before. And they found that wheat, rice, and soybean grown at elevated CO2 in these studies, it was between 550 to 600 parts per million, had lower concentrations of iron and zinc. Now, iron deficiency is very close to home for me as a pediatrician, because children are the highest risk group to iron deficiency. 25% of international preschool children are deficient in iron. And zinc is very important. Zinc deficiency is an important risk factor for infections internationally. I saw a child from Ghana a couple of weeks ago who brought with me her health record from Ghana, and there was a whole half a page dedicated to how to ensure adequate zinc in the diet to prevent infections. Whew, this was a very grim litany, and I expect many of you feel like this is just feeling a little like this with a whole lot of bad news. Well, I want to continue to do the rest of this talk talking about good news. So climate change is happening, we're causing it, it's bad for people's health, but it is not too late. And we are blessed in 2020 with the gift of a choice to choose the legacy we leave. And we can protect the health and the future of every person by protecting the planet. So the health system is uniquely positioned to lead in climate change solutions. One of my favorite organizations is Healthcare Without Harm, and I really appreciate this quote from them. As the only sector with healing as its mission, healthcare is an opportunity to use its ethical, economic, and political influence to be a leader in climate solutions. And I couldn't agree more with that. So recognizing our unique positions, physicians across the United States are coming together across specialties to work collectively to promote climate solutions. In 2017, our nation's leading medical societies formed a new medical society consortium on climate change and health. And this group now represents over half of doctors in the US through their medical societies. Now, healthcare is also a major contributor to the problem of climate change. If the global health sector were a country, it would be the 5th largest emitter in the world. And the US health sector is the world's largest healthcare emitter. So not only can we be a part of the solution, but we have to be a part of the solution. Hospitals are the second most energy intensive facilities in the country. We use a lot of water. We're the 3rd most water intensive facilities after hotels and senior care facilities. We use on average 570 gallons of water per patient per day, and we make a lot of waste. We generate about 29 pounds of waste per patient day in the hospital. So there's a lot of opportunity for improvement. So I'm going to talk a little bit about what hospitals across the country are doing. And this is just a few examples of the work that's happening in healthcare across this country. Ohio University Hospital Rainbow Center for Women and Children is the first hospital in Ohio to be LEED Platinum. They have on-site solar panels, which generate half of their energy use. They also have excellent indoor air quality, which is so important, particularly for children and for newborns, and permeable pavement and green roofing. We have some really good things happening in Virginia's health sector. Winchester Hospital partnered with Secure Futures Solar in Staunton to launch a 1.7 megawatt system that supplies about a quarter of their energy use. Now, this system cost them $0, and it's saving them $3.25 million in utility bill savings over 30 years. So that seems like a good deal to me. Carilion Clinic in Roanoke also partnered with Secure Futures Solar to create its solar system, for which they won an award from the governor. Their system also cost them $0 and is saving them about $1.5 million over 20 years. They have a 4,000 panel solar tracking field. They also retrofitted 30,000 light bulbs to LED lights and combined impact of reducing their emissions by 10 million pounds per year. Hospitals are addressing their emissions through the transportation sector with a focus on access to electric charging stations, public transportation, and active transport, particularly in more urban regions. And also we're working to reduce our waste. Inova Health System eliminated all styrofoam from their food services this year. I was very happy about that, as were the staff throughout the system. Now, physicians, nurses, and allied health professionals are coming together here in Virginia, and we are powerful advocates for climate action. We came together to work at the state level to advocate collectively for clean energy climate solutions through this new group, Virginia Clinicians for Climate Action. And what do? We were formed in 2017, and we now have hundreds of physicians, nurses, allied health professional, and health students spread across the state. We deliver education on climate and health. We used to do conferences, but now we're focused on webinars. We engage in advocacy and community outreach. And as I said, due to the coronavirus pandemic, we've transitioned our education to a monthly webinar series. So far, we've had 7. Our last was wonderful, Dr. Matthew Meyer from UVA Anesthesia, talking about the fascinating greenhouse gas, extremely high greenhouse gas potential of some anesthetic gases and the alternatives to be used in the operating room. And our next speaker is going to be pulmonologist, critical care physician, Dr. Drew Harris from UVA. We also hold yearly advocacy days where our members go to the General Assembly and speak directly to our legislators about why the healthcare community supports climate change solutions to protect our patients. This is a picture from our 3rd annual advocacy day earlier this year, and we were very happy to be joined by Secretary of Health and Human Resources, Dr. Daniel Carey, and to be recognized on the floor of the General Assembly. So in 2021, we're going to be focusing on air pollution from the transportation sector. Vehicles are the leading source of greenhouse gas emissions in Virginia. We published a report that you can see on this website, which describes the health effects of Virginia's transportation sector, specifically the health effects of particulate matter pollution. And the report finds that air pollution from vehicles in Virginia causes 2,600 child asthma attacks, 3,300 cases of child bronchitis or respiratory symptoms, and 220 new cases of asthma in women and children. These health effects are estimated to have a cost of $750 million annually in Virginia. And if you include vehicles coming from out of state, these health impacts and costs double. Now is when I'm going to try to do something tricky and show you all a video about made by Dr. Irene Mathieu, or featuring Dr. Irene Mathieu from UVA about transportation and children's health. So here we go. We're going to try this out. I'm going to exit this and go to the video. You should be able to see it still, I hope. Here we go.
My name is Irene Mathieu. I'm a general pediatrician at the University of Virginia, and climate action is important to me because children are some of the most vulnerable people when it comes to climate change. Traffic-related air pollution releases numerous chemicals into the air we breathe, including carbon monoxide, nitrogen dioxide, tiny debris called particulate matter, and more. Research has shown that traffic-related air pollution can lead to birth complications. For example, in one study, researchers found that mothers who lived in high-traffic areas during their 2nd and 3rd trimesters were more likely to deliver their babies too early. Other research has shown that even babies who aren't born prematurely can be born with abnormally low birth weight if their mothers are exposed to excessive levels of air pollution. Prematurity and low birth weight disproportionately impact communities of color, particularly Black and Latinx families. This is an example of environmental racism. Many Black and Latinx mothers are more likely to have premature or low birth weight babies, partly due to the exposure to toxicants like transport-related air pollution. As a pediatrician, I care for babies who are born too early or too small every day in my clinic. These babies often face an array of complications, including problems with feeding and growing, development and learning, and often have to utilize special therapies for the first few years of their life in order to catch up. Some babies never completely catch up and will have lifelong complications as a result of prematurity or low birth weight. That's why it's important to me that we decrease vehicle emissions by reducing miles traveled and providing sustainable ways for people to get around. This could look like investing in public transportation or ensuring that our communities are walkable with safe ways for people to get to resources that they need. For the sake of my patients and children all across the Commonwealth and the country, it's time for us to get serious about reducing transport-related air pollution. Their future depends on it. Climate solutions are health solutions, so let's work together to make sure that every child in Virginia can breathe easier.
All right.
My name is Irene Mathieu. I'm a general
Let me get back to my slides. All right. So in summary, climate change is happening. We're causing it. It's bad for our health, but it's solvable. And healthcare can and must be part of the solution because caring is what we do best. In conclusion of today's talk, I'm going to circle back to Isaac, and who's now 18 and has been joined by a sister, Ruby, who's 16, because it really is ultimately for the love of our families, our communities, and our beautiful shared planet that we care enough to do this work. Thank you so much for your time, and I'm very happy to answer any questions.